fellow viewers and students, I am Dr. Gazi Zakir Hossain, Associate Professor Surgery, Head of the Department of Surgery, Bashundhara Ad-din Medical College and Hospital. I welcome you all in the following class. I shall discuss today important surgical topics, spleen and its surgical aspects. Spleen is a large hemolymphatic organ, belongs to reticuloendothelial system. Spleen take part in formation of blood cells and immunity, so it is known as hemolymphatic organ. Other structure related to reticuloendothelial system are liver, thymus, tonsils, bone marrow, lymph nodes, lymphatics and paired spaces in the intestine. I shall discuss the topics into following division: anatomy of the spleen, function of the spleen, splenic trauma and its management, and management of splenomegaly. Regarding anatomy of the spleen develops from the condensation of mesoderm in the dorsal mesogastrium. It is located in the left hypochondrium region mainly and epigastrium between the fundus of the stomach and under surface of the left dome of the diaphragm. Its long axis lies along the 10th rib. The measurement of the spleen: regarding measurement, weight of the spleen is 75 to 250 gram and its dimension is 10 centimeter into 7 centimeter into 3 centimeter. Hilum of the spleen lies angle between the stomach and left kidney, and it is lies in the contact of the tail of the pancreas. It has two surfaces, concave visceral surface and convex diaphragmatic surface. Concave visceral surface lies in contact with the stomach, left colic flexure, left kidney and left adrenal, and lower pole extends up to the mid axillary line. Its convex surface is related or lies in contact with the under surface of the left dome of the diaphragm. There is a notch on the superior border of the spleen. This may be palpable when spleen is enlarged. When spleen is enlarged or palpable, it must be 2 to 3 times than its normal size, because spleen lies behind the stomach and costal rib, that is the ribs. When spleen is palpable, it must be enlarged, and enlargement is about 2 to 3 times than its normal size. There are some small accessory spleen may be present. This is known as splenenculi. In 30% of the cases, splenenculi are seen. It may be single or multiple. What is splenenculi? A small nodule of splenic tissue apart from the body of the spleen. স্প্লিন ব্যতীত স্প্লিনিক টিস্যু স্প্লিনের বাহিরে যদি পাওয়া যায় আমরা সেটাকে স্প্লিনাঙ্কুলি অথবা অ্যাক্সেসরি স্প্লিন বলে থাকি। its sites is hilum of the spleen near the splenic vessel. About 50% of the cases, splenenculi is seen in the hilum of the main skin, body of the spleen. Tail of the pancreas 30%, splenic ligament, that is the gastrosplenic ligament, splenorenal ligament, and mesocolon, and also in the greater omentum. These are the sites of the splenenculi or accessory spleen. In surgical point of view, it is important, so it is discussed here. In case of hemolytic disorder or blood disorder, we go for splenectomy. Then this splenenculi or accessory spleen must be removed, otherwise result will not be positive. Now, blood supply of the spleen. Spleen is supplied by the splenic artery which is the branch of the celiac trunk or celiac axis. Celiac axis is the ventral branch of the abdominal aorta, and it is tortuous, runs to the spleen from its origin through the upper border of the pancreas up to the tail. It gives small branches to the pancreas which supply the pancreas. On reaching to the splenic hilum, it is divided into upper and lower division, which subsequently divides and enters into the hilum of the spleen and supplies the spleen. Right gastroepipelic artery and short gastric arteries, which supplies the stomach, also branch of the splenic artery. Venous drainage corresponds to the artery, that is the splenic vein. Splenic vein emerges the hilum of the spleen and unite with the superior mesenteric vein behind the neck of the pancreas and forms the portal vein, which is the ending of the splenic vein. It is supplied by the spleen is covered by the external serosal layer and internal fibroelastic layer, and spleen comprises lymphatic drainage, that is the efferent lymphatic vessels emerges from the spleen. It has its own lymph node supply, lymph node drainage. Spleen is not drained by a specific lymph node, as it is a lymphoid organ. It has no lymphatic drainage, but capsule of the spleen is drained by the lymph node which lies near the hilum of the spleen. Sympathetic supply or nerve supply arises from the celiac plexus, which innervate the splenic vessels. All of you know that splenic structure, there is white pulp and red pulp. These are the parenchyma of the spleen. Now, the function of the spleen. Spleen has many functions. It has immune function, filtration function, pitting and cooling function, reservoir function, and cytopoiesis. Important function, immunological function. Spleen produces both specific and non-specific antibodies. Spleen processes antigen and is the major site of immunoglobulin production in response to antigen. These antibodies are B cell and T cell origin. Antibodies bounds with the specific receptor on the surface of the macrophages, leukocytes, and stimulate their phagocytic, bactericidal, and tumoricidal activity. Non-specific antigens like opsonin, properdin, taptin, interferon are also synthesized within the spleen. This is important immunological function. Among the function, immunological function is most important. These are the specific and non-specific immunoglobulin production. Next function is filtration function. Macrophages in the reticulum of the spleen capture the cellular and non-cellular material from the blood and plasma. This includes the removal of the effete platelet and RBC. These processes take place in the sinusoid of the spleen, splenic cords by the endothelial macrophages. Iron removed from the degraded hemoglobin during red cell breakdown is returned to the plasma for reuse. Removal of the non-cellular material may include bacteria and parasites like pneumococcus. Pitting and cooling function, particulate inclusion from the red cell, alive red cell are removed and they are repaired red cell returned into the circulation. Reservoir function, spleen contain approximately 8% of the total red cell mass, but this function is in human less marked than other species. But in enlarged spleen, it may contain much larger portion of blood during splenic enlargement. Next function is cytopoiesis, that is the cell production. RBC produced in the spleen up to 4th or 5th month of intrauterine life. Some degree of hemopoiesis occurs in adult spleen when bone marrow production of blood cells are inadequate. A stimulation of the white pulp may occur following antigenic challenge, resulting proliferation of the T and B cell of the B cell and macrophages. This may also occur in myeloproliferative disorder, thalassemia, chronic anemia, etc. What is the importance of splenic function in surgery? Previously, it is thought that spleen is dispensable. That is, no harm of splenectomy, that is after removal of the spleen. Increasing knowledge about the function has led to a conservative approach in the management of condition involving spleen removal. It is now recognized that accidental splenectomy during the course of another operative procedure increases the risk of complication of the patient and increases the death rate. The surgeon should therefore normally endeavor to preserve the spleen to maintain essential function described above. Now, what are the investigations we shall do before splenic surgery or splenic disease diagnosis? Full blood count, reticulocyte count, test of hemolysis, liver function test, SGPT, SGOT, alkaline phosphatase, prothrombin time, serum bilirubin, upper GI endoscopy for cirrhosis of the liver, lymph node biopsy for lymphadenopathy. Imaging investigation, X-ray abdomen, we can see the calcification, aneurysm of the splenic artery, old infection, cyst, hydrated disease of the spleen, and tuberculosis. In tuberculosis, we can see multiple calculi in the splenic area, multiple calcification. Ultrasonography, we can see the size, consistency, presence or absence of cyst in the spleen. CT scan of the spleen of the and abdomen, MRI, this can be used for the diagnosis of splenic diseases. Radioisotope scanning, especially technetium-99 label colloid to see the site of destruction of the RBC. Diagnostic peritoneal lavage, that is the DPL, in case of splenic trauma, we can do it. Now, splenic trauma. Spleen is the most common organ to be injured in abdominal trauma. Trauma may be closed abdominal trauma or open abdominal trauma. Closed direct trauma, indirect trauma or spontaneous trauma to the abdomen. Open trauma such as gunshot injury, punctured wound, iatrogenic injury during abdominal surgery such as gastric operation. Splenic injury grading parameters. Splenic injury are divided into 5 types or 5 gradings. These parameters are splenic subcapsular hematoma. After trauma, if there is development of subcapsular hematoma, we see the size of the hematoma. What is the size of the hematoma? What is the percentage of hematoma involve the whole surface of the spleen? Spleen যে সারফেস এরিয়া আছে সারফেস এরিয়ার কত পার্সেন্ট হেমাটোমা হইল ইনসাইড ওন্ড অর ল্যাসারেটেড ওন্ড ইন দ্য সারফেস অফ দ্য স্প্লিনের সারফেসে অথবা স্প্লিনের সারফেসে ইনসাইড ওন্ড অথবা ল্যাসারেটেড ওন্ড কতটুকুন আছে এটা কত সেন্টিমিটার তার উপর নির্ভর করে স্প্লিনিক হাইলার ইনজুরি দ্যাট ইজ দ্য টরেন্সিয়াল ব্লিডিং স্প্লিনিক হাইলার যদি ইনজুরি হয় ব্লাড ভেসেল যদি ডিভাইড হয়ে যায় দেয়ার উইল মে বি টরেন্সিয়াল ইনজুরি অ্যান্ড টরেন্সিয়াল ব্লিডিং and patient may be go to death instantaneously at the spot. Splenic injury associated with other organ injury. These are the 5 parameters which are used for the grading of the splenic injury. This grading is important for the management of subsequent management of splenic injury. Grading of the splenic injury based on ultrasonography, CT scan and operative or autopsy finding. As mentioned above, size of the hematoma, the percentage of the splenic surface involved, size and depth of the wound measured in centimeter and nature of the wound. It is divided into 5 groups or 5 grades. Grade 1 laceration less than 1 centimeter deep or incision less than 1 centimeter deep, subcapsular hematoma less than 10% of the splenic surface. This is grade 1. And hematoma, subcapsular hematoma 10 to 15%, 5 to 50%. Subcapsular hematoma 10 to 50% of the splenic surface and intraparenchymal injury less than 5 centimeter. আগে ছিল 1 centimeter, এখন হলো less than 5 centimeter. এটা হলো grade 2. Grade 3, hematoma more than 50% of the splenic surface and laceration or incision more than 5 centimeter. 5 centimeter less, এখানে more than 5 centimeter. আর laceration এটা হলো grade 3. Grade 4, laceration, segmental or hilar basal injury, that is the devascularization. It is known as grade 4. And grade 5 হলো shattered spleen, that is the avulsion of spleen from its pedicle. This is grade 4. 5. Grade 1, hematoma, subcapsular hematoma less than 10%, deafness, depth of injury less than 1 centimeter. Grade 2, hematoma 5 to 10 to 50%, 10 থেকে 50%, intercapsular injury less than 5 centimeter. Or hematoma more than 50% of the spleen and incised on or lacerated on more than 5 centimeter. এটা হলো grade 3. আর grade 4, laceration, segmental or hilar basal injury, major devascularization. আর হচ্ছে grade 4, 5, laceration, that is the shattered wound or avulsion of the spleen from its pedicle. Now, grade 1 and 2. Grade 1 and 2, it is a minor splenic injury. Grade 3, it is a moderate splenic injury. Or grade 4 and 5, it is severe splenic injury. It is severe splenic injury. Associated injury with splenic injury, all of you know that the structure lies around the spleen or in the vicinity of the spleen, left lobe of the liver, tail of the pancreas injured. Left kidney may be injured, left colon may be injured, small bowel may be injured, diaphragm or left lung may be injured, fracture rib, especially left side, 30% of the cases, left side may be pneumothorax. This is the grading of the splenic injury with associated injury. In the next class, we shall discuss about the clinical types, clinical presentation of the splenic injury. It is known as fatal, delayed presentation and classical presentation. We shall discuss this later on. Okay, thank you all. Assalamu alaikum.